we are doing it in the form of a healthcare agreement, but I think the more important part of it is actually building a community and moving forward together on a cross-sectoral level even. I think I should also mention that. So it's not only people acting in mental health care, but generally in our social landscape and healthcare. Yeah.
And if I can just continue that, one example is of that in Sweden is the interface between specialist care, primary care, and student and school health. Who is going to do what? And how can we address this problem with the increasing problems that we see? And I think it's a lot of things. It's attitudes, it's culture, and it's also laws and regulations, because it's strictly regulated in Sweden what are the school health intended to do, and it's a lot of prevention and stuff like that. And maybe it should be possible that the schools could get extended tasks in this area. That's what the government is trying to say and trying to investigate. That could be one thing. I think because the most common problem in Sweden is children with neuropsychological symptoms. I learned the other day that I can call them ADH, but maybe they don't have the D in ADHD. But in Sweden, it's common that to get extra care support in school, you need a diagnosis. And to get a diagnosis, you need the neuropsychological assessment. And that's a long way around. But we try to move to, maybe it's possible to give that support even if you don't have the diagnosis, just with a suspicion about it might be this. That could be a way forward.
Okay, I want to come back to the issue around having a diagnosis to get help, because that seems to be a challenge everywhere in the world, but we'll come back to that point. Go ahead, Claudia.
For me, it's basically a lack of resources for sure, but a perceived competitiveness in priorities that is making really difficult to have a proper ecosystem approach, because people become defensive about their own areas. Mental health is across all policies, but it's still quite split at European level. So the Director General for Health did try with this comprehensive approach to take these mental health in all policies. But at the European level, to add to the layers of complexity, health is a competency of the member states. So the European Union can give a strategy, can give a way forward, but at the end of the day, health remains a competency of the member states, which adds to, as I said, the complexity. And then the other thing is, of course, the culture. It's quite hard in mental health to move away from, as I said before, like a more biomedical, illness-oriented approach towards an ecosystem or a holistic approach to mental health. Because we know a lot about it, but the people we talk to don't necessarily, and they try to do something about it, but sometimes I still have the feeling that they're trying to do, but there is not the proper understanding of it, and then sometimes you get the persons that actually have that understanding of it, but then they go. And so you need to restart.
Yeah. So all of you are saying in some way that to really affect policy, it's not just sitting in a room writing out policy, it's really trying to get other people to understand, as you're saying, it's trying to get people to think differently about issues. Can you talk about what some of your strategies have been that you found to be successful in really helping to build the kind of coalitions, to build trust, to get people to think differently to advance the policies that you're trying to advance?
Well, for us, it has been, we've worked on various things. First, it is very important as an organization or as a leader to have credibility. And for us, part of it is also maintaining our independence, and that is why we don't get funding. It's in our statutes. We don't accept funding from the healthcare industry because we want to be able to call out when things are not going well. We need to remain independent. So it's credibility. For that, we are also working more and more into being involved in creating evidence. And often our role is actually the one of bringing co-creation to research and to science, because it is really important to have the input from all people involved and that their input is equally valued. And then, of course, the building coalitions. So Mental Health Europe, we have created various ways. We are coordinating on the health policy platform of the European Commission, a group of mental health policies for exchange of practices. But then on the advocacy side, we also have an advocacy platform for all those organizations for whom mental health is not necessarily the core business, but it's a very important part. It can be organizations that work with older adults, that work with youth, that work with LGBTI plus communities. So everyone for whom mental health is important. And when you have that group with you, when you are in a group, you create a movement that will sustain your efforts, and of course you will have much more impact because there are so many voices out there. And then the use of evidence. We have data that say, you know, mental health is important to people in Europe, so it's not something that can be disregarded. And that's a very important argument, because you go to the policymakers and you say, it's out there, people are saying over and over that it's important. The latest Eurobarometer data say that almost 90% of the respondents think that mental health is as important as physical health. You have that, you use that, and that gives you a way in.
Well, I think for us what has been successful is making this agreement together, building a coalition, and focusing on some priorities. Digital health care has been very helpful, but also the cross-collaboration of the social landscape and healthcare. And I think in the end, building a learning community. Because we started this agreement 2.5 years ago, and already now, yes, we're having our first successes, but we're also learning what we have to do more.
Yeah, and if I continue with the coalitions, and I think most people are converging to the same thing, that you want to find a solution of these problems. But also, this is a type of thing that it takes time. You have to talk, meet a lot. And for example, the assignment from the government to bring out this national strategy, it was decided almost 4 years ago, and it took 3 years for 26 different agencies to find times to meet, to discuss, and it took a long time. Maybe it was too long time, but I don't think so actually, because it's well invested time. Because maybe then when they might be ready to start some action when we have the strategy in place. And it's all about it's not just building coalitions, it's about building trustful relations, isn't it? And then you have to spend time with each other, for example, like in a marriage. You have to spend time together to make the trustful relations, right?
Really?
Yeah.
I've been married 38 years.
Yeah, you haven't started?
I know. Okay, 38. Oh, my wife just told me that was the wrong number of years. So tip to presenters: get your facts straight before you get on stage. Go ahead.
I just wanted to say something, because you said, oh, it took a long time, and then you said, oh, but actually, I mean, it was time well spent. One of the things that is brought up often when we ask for a strategy is that it takes so much time that it's, you know, it's time that nothing is going to happen, and so then you're stuck, and because it takes too long. So it's good to have people reflecting on, like, it might take time, but it's actually well spent time. And that's maybe something that we can bring. You know, it's happening at member states level. It's well spent time.
I think the dilemma working from a policy point of view is that there's also always political pressure, and it's focusing on accessibility, and it's hard to explain that these things take time and that you have to build trust, because I agree, you have to build trust, and it takes a long time, and it's well spent time. But in a political, when the discussion politicizes, it's difficult to point this point forward. Yeah.
Yeah, so how do you manage it? Because I absolutely agree that you don't make policy in a vacuum. You make policy in a context, and often it's a political context, it's a social context. And I think what I'm hearing all of you say is that policy making isn't this sort of pure science over here that you can kind of do in an office. It is engaging in the political systems. It's engaging in understanding what's happening in your society and engaging people in your society. It's about building coalitions. It's about taking time and convincing people that these are not problems that are going to be fixed overnight. So how do you manage all of that and then still get, I mean, one of the things that I've heard, I think many of us have been inspired by many of the stories that we've heard from people. And we just heard a great story about how people get hope for suicide or who've had suicide. How do you translate those ideas, those things that people get excited about? How do you get them through the political system, all of the other things that you have to do to actually make it happen? Because I would imagine that there are people in this audience who've had great visions, but then run into all of these roadblocks. So help folks think about what has worked to help you get through some of those roadblocks that are really important if you're going to make good policy for people.
I think what is really helping us in the Netherlands is that we have these regional plans. I mean, these are still, big regions, and as an individual, it's also hard to influence them. But it gives you the power to put forward what you think is necessary in your local area, what you need in your direct environment. And I hear of the people who are involved in these regional plans that it's hard for them to get the people who have experienced what is necessary to have help, to get them involved. So, you can find them on the internet in the Netherlands, the plans, and also the organizations that are involved. And it's really a question of calling them up and putting forward your idea. Because we are all the parties in the National Healthcare Agreement really would like to get these plans forward. Yeah.
Okay, so you have to be very active in getting people to buy into the ideas. It's not
that's hard.
It's not just putting them out there, but it's how do you get them engaged in that. Any other ideas that you've seen work to try to get your policies through these systems?
I can think about the regional plans you're talking about. We have like 20 regions in Sweden as well, with separate plans. But I would think that the plans are good, yes. It's a lot of words in there, but you have to translate them into activities so that the people on the local level can recognize themselves and say, hey, I have an idea. It's about this area. And can we do that? And help people do the things that they believe in, concrete stuff. And that's an important thing. And also couple these things. Yes, this is in line with the strategy that we have in the regional plan, the national plan. So helping, and that's part of the leadership, helping people understand the connection between the different levels. I think that's important for me, anyway.
Claudia?
I think for us, what has worked is to know the system and its complexity. So when it's policy and advocacy at the European level, there are three main, I'm simplifying, interlocutors, which are the European Parliament, the European Commission, and the Council of the European Union. And each of them would be interested and would be listening to slightly different things. So you get storytelling, very good, the European Parliament. The European Commission wants data and technical information, because that is what they are also there to propose. And with the Council, you need to know the specific needs and interests of the Member States, because the Council is made of the different Member States. At the same time, it's so you have different entry points. You need to know your system, know what you can do and how you get in there. You need also to decide what you want to do, because you cannot do it all. And I think that that's very important for leaders. You cannot do it all. Just choose and be clever about that. Coalitions or alliances with international organizations, very important. So Mental Health Europe is a recognized, accredited non-state actor with WHO Europe. We work very closely with them. And that is very important, because they are part of the dialogue, of course. And then also bringing in from the grassroots, what we are focusing a lot is the co-creation approach. And it's been very interesting, because there is an appetite for it, and with some organizations more than others, of course, and with some institutions more than others. But there is, at least now, and that has been a bit a shift, there is an open mind, or at least there is a crack when it's not yet open for it. And so that's where we are going.
Great. A little earlier ago, Martin, you started to talk about kids who cannot get help because of the problem of needing a diagnosis sometimes. So all of you have talked in some ways about changing the paradigm that we've historically had. Can you talk about how you think the mental health paradigm needs to change, and then what are some things that you think are important in terms of trying to advance that paradigm shift?
I think that's a very important and a very hard question at the same time, because more and more we learn that your mental state of being is a part of life. And I mean, how do we find a way forward in just being able to talk with each other about how you feel, and how you are able to cope with your mental state at the time? We have had campaigns about it. We have, of course, talked about it in many, many ways, and still it's very hard. At the same time, I found it very hopeful, if you permit me, a very short story. In the Netherlands, in high school, the last year of your high school, you have to do a paper and you have to give a presentation, and all the parents come to listen to the presentation. And I was visiting the presentation in the classroom of my daughter, and it's like 16, 17-year-old boys and girls, hormones everywhere, acting tough and making jokes. And then there was this boy, a 16-year-old boy, and he said, I'm going to do my presentation on male mental health, because I see that there's a lot of talk in the news about female mental health, but never about male mental health. So I thought, I'm going to look up the numbers and what we are doing about it, and very interesting presentation. And I'm 54, being very old-fashioned, thought, well, oh, okay, because then afterwards the kids were allowed to ask questions to each other, the parents also. And I saw some tough boys in the front of the classroom saying, we would like to ask a question. I thought, oh, this is going to be a very stupid question. But there was this 16-year-old other boy who had been making jokes the first half hour. And he said, well, I'm so very happy that you talked about it, because my cousin, he committed suicide. And what should I have done to help this cousin of mine? And there was the guy giving the presentation, and he said, well, I think the most important thing we can do is just talk with each other. If you see a friend acting a little differently than normal, or you haven't just spoken to someone in a while, just call them up. And I mean, this is this generation always looking on their phones, and I thought, well, this is what it's about. Young people sharing their experiences, talking about it as a very normal fact of life. It can happen to any one of us. And it's very much about seeing it as a normal part of life and talking about it. So as a policymaker, what makes me very hopeful is that it's not about policy, but it's about young people finding this more and more normal. So maybe as a policymaker, I shouldn't do that much. I should just see to it that in classrooms there is this, that people feel free to talk about these issues.
Wow, that's great. That's a really great story. Go ahead.
Yeah, so if I can build on that, because I think that we need to move away from this idea that we need to fix people. What we need to do is to really pave paths for recovery where people are in the driving seat. But this needs to start, I'm a really strong believer that it needs to start with the young people, like really in school. And in schools, you need to allow for a culture of diversity as well. And if you teach children that diversity is a normal part of life, that it is fine that you can talk about things, mental health, you know, you have different, there is a continuum and you have ups and downs. In some cases it can become a psychosocial disability. But if you normalize the conversation, if you create that culture, then kids will have less of a problem seeking for support. They will have less of a problem speaking up. They will know how to support other people. And that is how you're going to create resilient communities. So it's the education part, it's really, really important because it's the culture that you need to change.
And I agree with both of you, but in the same time, we have to have systems and knowledge to see that that specific child needs to come to specialist care now, immediately. Yeah.
Well, you know, I hear you all saying, and I actually believe this, that we have to change how society talks about these issues, how people, you know, as you're saying, to normalize these issues. And I'm just wondering, from your perspectives, how do we do that? Because I think all of us face that challenge. One of the biggest challenges, I used to say when I was a mental health commissioner that, you know, we could have all the great programs in the world, but if people don't want to come to them because of stigma, it doesn't matter, right? So in some ways, as policy people, it's not just about creating the services, it's also dealing with the other side, which is to make sure that people will actually want to use them, know how to use them, that there won't be the stigma there. I'm just wondering if you all have thoughts about what we could be doing as a mental health field to help change that so that it is more normalized.
Can I give two examples?
Yeah, sure, yeah.
One is we created a glossary on mental health because we feel that language has really a strong power. The words that we use also will define the way that we think. And so, I mean, we can share it somehow. It is anyway on our website. And the interesting thing was that we created this, co-created this glossary. So it was co-created by our members from different backgrounds and experiences. And we have really basically disseminated it a lot. And I started hearing, it's not perfect yet, and even some of our members sometimes you see like, here's the glossary, have a look again. But I started hearing a change in the way that people talk about mental health, which is becoming less stigmatizing, which is becoming less biomedical, and that actually is something that gives me hope. And then the other thing is co-creation, because we need to stop. We cannot afford anymore to have services or policies that don't work. How do you do that? You really need to make sure that you know what is needed, what are the barriers of citizens, and you need to have the people that use the services there. You need to have the people that deliver the services there. You need to have the policymakers there. But you also need to have an environment when you do that where it's not tokenistic. The people feel safe to share. The people feel valued. So it's very important. And there are various principles. We have guidelines and a toolkit to do that. You need to do it right. And when you do it right, then you can really make giant leaps forward.
Does anyone else want to add anything to that? That's fine. We have about 7 minutes left. So I want you to talk a little bit about how you know, if you could snap your fingers and really create the kind of system and approach that you would love to do, how would you love to have in your countries? What would that look like for you? If you could, in just a few sentences, talk about what would it look like to have the kind of approach to mental health that you think we need to have?
I would like to have a world where mental health is just a normal part of life, and people also know how to take care of it for themselves, but also helping others. And at the same time, that where really healthcare is needed, that it's accessible. And the third thing is, I would hope that there would be, if you're a family member of someone who needs care, that you also know where to find help, because that's really hard also in the Netherlands.
That's a really positive political answer, if you understand me right. That's really good to hear that. Yeah. For the Swedish context, we have to be much better including the social society, much more than we do. And I was so impressed. One example, I got the opportunity through Beverly Rose to get a site visit at the ENIC Recovery College here. ENIC. Hi, Beverly. ENIC, sorry for that. And it was really a highlight for me this week to see. Yeah, and a bike guided tour as well. Yes, true. And we met Renee Keith on the way. Yeah, but what I would say, I thought that was a kind of meeting point, but I understand it was much more. And that's the type of thing. We have politicians in Sweden really interested in this. We have to get something going on. That type of examples evolving. There's a lot of things going on with new evidence-based treatments in specialist care and the primary care. They are increasing their knowledge, but we need to. It's not going to be enough. So we need the civil society. Thank you, Beverly.
I think for me, the dream of the dreams is that it is the well-being of people that is at the center of all policies, and not things such as growth, like infinite growth, which I guess in a much broader way would be, if we need to have an economy, it should be an economy of well-being. We need to come back of what is important for people, for all people. What?
Great. So we want to end on this. What gives you hope? We're all struggling with many of the same challenges, but what gives you hope about the work that we do as a field?
Okay. For me, it's seeing some changes happening, but also the feeling that I'm not alone, and with my organization, I'm not alone. So all these alliances that we have built, there is interest, and just the fact of not being alone, as in many other aspects of life, that's something that is very important, and that gives me hope, because there is a movement there, and it's great to know that we're not alone.
Great.
And actually, you just posing that question gives me hope, because we have to talk about hope much more than we do, and meaning, and how to create meaning in your life. This type of stuff that WHO, existential health, spiritual health, and that's a resource that we haven't used, maybe in all other countries, but not in Sweden, as being the most secular country. But also little things, big things. The ENIC Recovery Center, meeting you, Thomas, at this conference and having discussions of these big issues in life. A lot of things. So we have to spend more time talk about exactly that.
Well, there are many things that give me hope. The agreement we built together, the coalition, that's having its first successes. It's visiting all kinds of initiatives in the Netherlands where you see that people find ways to help each other. And I think the last is, well, I just mentioned him, the 16-year-old boy in a classroom full of tough teenagers who were able to talk about this so freely. That gives hope.
And that is a great way to end this panel. And I want to thank, and if you could all thank our panel for sharing their knowledge. Thank you.
All right, thank you so much. I'm honestly becoming even more hopeful with you guys being so hopeful. So thanks for that. Yeah, round of applause. I heard some applause, let's give another applause. Why not? All right, before we're going into the break, I want to make a quick note that the next sessions in this room are going to be about conflict and can be a bit sensitive. Well, they are quite sensitive. So I wanted to remind you that we have a quiet recovery room in the back of the building. Just go here around the corner, and then in the far left, you can have some time for yourself to recover, to just get some quietness around you. But for now, enjoy your breaks and be back at, let's see, 10:55.
You free my mind.